This video we are going to talk about arterial blood gases, which is a very important thing to talk about and to understand, because so many patients, when they come to the emergency department and the intensive care unit, they are either short of breath because of the metabolic acidosis, or they are dyspneic, or they have labored breathing and they are not able to remove the carbon dioxide from their body. So all these can be known by having a basic understanding of the arterial blood gases. Let's talk about them. Blood for the arterial blood gas analysis is taken preferably from the radial artery. Some people do go for the brachial artery or the femoral artery, but better always to opt for the radial artery, because it is very easily compressible. There is a bone right behind this artery, so this is an easy to compress because this is the arterial blood. So the larger arterial puncture can cause the problem. So what are the important components when we are to talk about the arterial blood gases? This is the basic review. One is the pH, which is the inverse log of the hydrogen ion. One is the partial pressure of arterial oxygen. This A stands for the arterial. Then is the partial pressure of the arterial carbon dioxide. And lastly, it is the bicarbonate, which is important. So these four entities are very important while we are talking about the ABGs. Talking about the normal values of these important entities, pH is 7.35 to 7.45, and partial pressure of arterial oxygen is 60 to 100 millimeter of the mercury, and partial pressure of arterial carbon dioxide is 35 to 45 millimeter of the mercury, and the bicarbonate, which is being dealt by the kidneys, and carbon dioxide is being dealt by the lungs. So bicarb is normally 22 to 26 milliequivalent per liter. Talking about the abnormal values, pH, which is an inverse log of the hydrogen ion. When the pH is less than 7.35, we call it acidosis. That means pH is low and hydrogen ion is more. But if the pH is more than 7.45, that means hydrogen ion is less in the body, then we call it alkalosis, and pH is more because it is an inverse log. If the partial pressure of oxygen is less than 60 millimeter of the mercury, we call it a type 1 respiratory failure, like it happens in pneumonia, acute respiratory distress syndrome, and pulmonary edema in cases of the left ventricular failure. And then we need to give more oxygen to these patients because they are in the type 1 respiratory failure. If the partial pressure of the carbon dioxide is less than 35, we call it the alkalosis, and if the partial pressure of carbon dioxide is more than 45, we call it acidosis. See, partial pressure of carbon dioxide is dealt with this organ which we call the lungs, and this component is known as the respiratory alkalosis or the respiratory acidosis. Last component of the ABGs, which is bicarbonate, it is related with the kidney. Either kidney retain them or get rid of them by excretions, and this limb is known as the metabolic limb. If the bicarbonate is less than 22 milliequivalent per liter, we call it the acidosis, and if the bicarbonate is more than 26 milliequivalent per liter, we call it the alkalosis, and this entity is known as the metabolic. Now, by looking at the pH paper of any patient, we should have the answers for the two very important questions. Question number one: what is this ABGs? Whether this is acidosis or alkalosis, and what is causing this problem or change in the pH? What is causing this acidosis or alkalosis? Is it the respiratory component or the metabolic component? So whatever will be causing the change in the pH will be known as the primary problem, and the other component will be trying to negate or decrease the effect of that change. That limb will be known as the compensatory limb. For example, if the problem is caused by the respiratory system, then the metabolic system will try to compensate it, and if the problem is caused by the bicarbonate or the metabolic system, then the respiratory system will be bringing in a change which will lessen, decrease or negate the effect of the change in the pH. This is how this system works. In order to have this answer, whether the ABGs are acidosis or alkalosis, respiratory or metabolic, we are to follow the 4 steps. The step number one is, when we are looking at the ABGs, we are to look at the pH of the ABGs to name whether these are the acidosis or the alkalosis. This is the step 1. Always follow this. If the pH is less than 7.35, we call it acidosis. If the pH is more than 7.45, we call it alkalosis. So this is how initially we name the ABGs. Then as a step 2, we are to look at the status of the partial pressure of carbon dioxide in these ABGs. If the partial pressure of carbon dioxide is less than 35, we will call it alkalosis, and if it is more than 45, we will call it acidosis. As a third step, we will look at the status of the bicarbonate in the above ABGs. If the bicarbonate is less than 22, we call it the acidosis, and if bicarbonate is more than 26, we call it alkalosis. Most important step is the step number 4. After we have known that pH is telling this thing, PCO2 is telling this thing, and bicarbonate is telling this thing, then we are to compare the change in the pH with the change in the partial pressure of carbon dioxide and change caused by the bicarbonate, and whichever is coinciding with the change in the pH will be the primary problem, and the other component of the ABGs will behave as a compensatory. For example, if I give you example, for example, if the pH was 7.28, which definitely falls in the category of the acidosis, and the PCO2 was 49 or 50, which also falls in the acidosis, and bicarbonate was 29, which falls in the category of alkalosis. So the pH change is acidosis, PCO2 is acidosis, and bicarbonate is alkalosis. So the logic says that the change in the pH is because of the change in the carbon dioxide, and bicarbonate is trying to go in the opposite direction to decrease the effect of a higher PCO2 on the pH. So the primary problem in that example will be the carbon dioxide, and the compensatory will be the bicarbonate, and these ABGs will be known as the respiratory acidosis. Let's take this example. We have got an ABGs of a patient of asthma, and the ABGs show us that the pH is 7.28, PaCO2 is 50 millimeter of the mercury, and bicarbonate is 29 millimole per liter or milli equivalent per liter. So let's go for the step 1, where we from the pH we know that the normal value of the pH is 7.35 to 7.45, and if the pH is less than 7.35, we call it acidosis. So the pH here is obviously less than 7.35. So this is acidosis. Secondly, let's look at the status of the PCO2 and bicarbonate by following the step 2 and 3. Step 2 tells us that if the PCO2 is less than 35, we call it alkalosis, and if it is more than 45, we call it acidosis. So here this is obviously more than 45, so this is again acidosis. Now looking at the bicarbonate as a step 3, normal value is 22 to 26. If the bicarbonate is less than 22, we call it acidosis. If it is more than 26, we call it alkalosis, and here this is obviously more than 26, so this is alkalosis. So when we come as a step 4, when we compare that, the name of the ABGs is surely acidosis because the pH is in the acidosis range. Now if we see whether PCO2 is acidosis or bicarbonate is acidosis, now looking at here we see the PCO2 is acidosis. So this ABGs is primarily a respiratory acidosis because PCO2 is dealt by the kidney, by the lungs or the respiratory component. So primary problem of this patient is the respiratory acidosis. Some process is retaining the carbon dioxide here, which can be the bronchoconstriction. Now the bicarbonate will be retained by the kidneys so that the change in the pH brought about by the change in the carbon dioxide can be decreased. That is the reason that body is having now more bicarbonate because of retention by the metabolic limb or the kidneys. So here the primary problem is respiratory and the compensatory limb is coming from the kidneys. So this is basically the respiratory acidosis. So if you like the video, please subscribe the channel and also share the video, and ask your friends and other doctors to like the channel. And if you do not like the video, please give me the suggestion to improve the quality of the videos and quality of the channel.